Well, 26 people have died so far after contracting the virus, which attacks the respiratory system. All of those deaths have been in China, mostly in and around Wuhan, but now there have been 2 deaths outside Hubei province for the first time. Nationally, there are currently 830 confirmed cases of patients infected with the virus. Another case has now been confirmed in Thailand, bringing the total number of international cases to 14. The WHO, the World Health Organization, has said it doesn't yet consider it to be a global health emergency. Attempts to stop the spread of the virus are being enforced in many countries around the world. Here in Hong Kong, people had to queue to collect refunds after they cancelled their travel plans for fear of travelling to an infected area.
Footage for you this morning. It's extraordinary, showing excavators working furiously as they break ground in Wuhan, the epicenter for the outbreak. They're racing to build a new 1,000-bed hospital to treat patients. And they say this one is modeling the one built in Beijing at the height of the SARS outbreak back in 2003. They plan to have this new hospital finished by next Wednesday. That's 5 days from now.
Meanwhile, a team of Australians is trying to develop a vaccine for the virus.
We're aiming to produce an injectable dose, so pre-filled syringes that can be sent around the world.
They're working around the clock, but it will likely take 6 months.
Infection control practices is very important. It must be introduced and it must be done appropriately.
People who returned to Mumbai from China have been kept under observation at a government hospital in the city for possible exposure to the deadly new flu-like virus that has killed 26 people so far and infected over 800. The 2 were sent to the Kasturba hospital. Let's go across to Saurabh for more on this story. And Saurabh, they've been kept in an isolation ward. Do we know the details? How were these 2 sent to the hospital? Were these people who just arrived back from China, and it was at the airport that they were suspected of having the coronavirus?
I got the call around 9 p.m. Was able to be at the hospital, I think about 9:45. Luckily, we both live close by. The page went out to the nurses that we needed to open the unit, and we were able to accept the patient around 11:30 p.m.
Then I got a call from Sarah Wilkerson, our infection control manager, telling me that we had an incoming case of coronavirus and how we should handle it.
Having the very first patient in our hospital, it is a little, scary. It's something new.
We will wear just standard rubber gloves, and we have a fluid impermeable gown that we'll put on.
In this particular patient, we weren't sure about the degree of contagiousness. We certainly did not want it to spread, so we used the highest level of protection that we have available to treat this patient, as one would Ebola.
The nurse will put it on her head. And then we have the plastic machinery that fits around.
What we know so far is that they believe that it's spread potentially through droplets when you breathe or cough or anything like that, as well as contact, so actually direct contact with the patient or the surfaces that may be contaminated.
And then the patient himself is in a separate, they call it negative air pressure room.
Well, I would again refer to the CDC's recommendations, but if there's a concern that you're symptomatic and you know that you either traveled to an area of concern or had exposure to somebody with a known disease, contacting your healthcare provider, let them know over the phone that you have a concern prior to going in so that they can make sure that they can safely prepare for your arrival.
Okay, the draft is basically 3 parts. Number 1, early recognition and control. That means you pick up the case quickly and then implement your control. The control has 2 more parts. One is standard precaution. Standard precaution refers to those practices you do for all patients, okay? Now, but then the moment you have a suspect or confirmed case, it's recommended here that you implement contact and dropless precaution. Now, it will take a long time to describe that, but all the details are given here, and it's important that hospital implement this. Now, let me press on to say this. It's very important to implement infection control practices, but it must be done appropriately. If you don't do it appropriately, it can even be dangerous.
Rushing to catch the last trains before the Lunar New Year, many of these passengers at the Beijing West Railway Station are thinking of the coronavirus.
I don't think this virus has been properly controlled. I just came back to China. I read a lot of news on the internet. I'm not very satisfied with how the government prevented and controlled the disease. I'm very afraid of getting infected.
Here in Beijing, those prevention control measures that, of course, you've worked on very closely, are they being implemented at the right level here in China? And can the health system here in China cope, given the sheer numbers of people now that are pressuring those services?
Now, in fact, there's a lot of documents here. The WHO got it here. 2014, a second edition. This is a document by WHO, 2014. In fact, I play a big part in preparing this too, in which to deal with any novel acute respiratory disease. So it's not that it's new, it's already out, you see. Now, then I hold another WHO document, 2016, again a second edition. I was involved in both editions. And this is talking about the core component you need to have to implement infection control. Now, I can say a lot of things, but two things very important. This document says you need to have administrative control. That means it's not just talking. You need to set up a management system, which includes full-time infection control nurses. You see? If you have no full-time staff, it's just like in your station. You need a full-time staff, you see, to do all these little things, you see. And then also, you need education, all the time, you see.
The World Health Organization has decided not to declare the current outbreak a global health emergency. But there's growing concern over the coming week when the millions of people who have traveled for the holiday return.
There is so much news, so much concern out there about this coronavirus. What can you tell us?
Well, first of all, there's a big difference to SARS, for example, that we have a much more transparent China, and actually the action of China is much more effective in the first days already. We have an international cooperation. We are in daily contact. Our CDC, for example, the Robert Koch Institute in Berlin, the European CDC, the international community is daily checking what's going on. But what I find important is that we put it into a sober perspective. You know, for example, in Germany, up to 20,000 people die because of the flu. So if you put it into that perspective, we take it serious, we are prepared and keep on preparing, but at the same time, I think we have to put it into perspective.
There's lines of people trying to buy masks.
Sure.
And just tell us, do they actually work in times of an outbreak, and why are people not putting them on right, or are they?
It works. We have done many studies. Believe me, it works. But several things. Number one, you must have the right protective equipment, the right mask. Now, this is the right mask. You see, it has a blue color on the outside because it's waterproof. And it's 3 layered so that it won't penetrate. If fluid falls on it, it won't go through, you see. And then you have white on the inside, which is absorbent.
Yeah.
So if I cough, it absorbs it. Now, so you're going to wear it like this. The blue on the outside, the white on the inside. You have seen people wearing it like this. Totally wrong, you see.
Yeah.
So it's not just the right. You see people wearing masks, there's only one piece of paper. Those are not for infection control.
Sure.
All right? Now, so the right gear. Then wearing it correctly. Now, you see this here? This tight little thick band here is to show you that you should put it on the top.
Yep.
Why? Because once you wear it, then you squeeze it so that it matches.
You got to pinch the nose, yeah.
You pinch the nose, and then you pull it down. See?
Yeah.
Now, so it clings onto the nose.
Yep.
Very important because you don't want it to fall like this. You have seen healthcare workers. In fact, if you see someone doing it, say, hey, please, you got to cover your nose. And then, have you seen doctors doing this? I don't know whether you have seen doctors doing this. You know, talking to you like this.
Yeah.
This is wrong.
Got to cover it up. All right.
Cover it. Now, just give me 1 more minute. Now, the removal is just as important. You've got to listen to this. Because once you wear a mask, you should consider it dirty. Then when you remove, you don't touch it. You remove it such that...
Oh, everything's falling.
You remove it such that it touched the, oh, so sorry.
It's okay. It's all getting tangled.
Yeah,
but,
it's all entangled.
But thank you so much for
But
showing
we just,
that.
you remove
People
it, don't
need to
touch it
know
and
this.
drop it.
Yeah.
And then do hand hygiene.
Yeah.